class.
Okay, sir.
Okay.
Good evening, everybody. I'm welcoming all to our today evening's program. Our memberships are coming down very just now. I think we should make sure attendance are more hereafter. So now I request Surendra sir to continue the class. Surendra sir.
Thank you. Dear friends, welcome you to another session of enlightenment program.
Okay, sir, your mic is on.
Ah.
Yes?
You carry continue.
Okay. See, things are changing. Leave alone weather and other things. Politics. The war loom. Yes, we are in the modern day. We are bound to know what is happening in the world. We not be afraid of it. We should not take it into our brain and cause a symptom for us. Not but climate is no good. Climate is no good. It is not helping. They used to say, come September, throughout the world, they invade September because that month will be a pleasant. But even the September month may not be conducive or helpful to us because of global warming. There is something carbon emission, this and that. In another way they say industries, pollution and everything. But with all that atmosphere, we must live. We must keep our health healthy. We must be able to overcome all the problems. For example, I come across an article where they say the honeymoons most often repeated or chosen medicine is Dicamba. He used to give Dicamba often. Dicamba is meant for symptoms of important locations and we can learn the specific symptoms expressed by the patient, can understand. When the patient locates their symptoms mostly in the whole of the umbilical region, Hahnemann used to choose immediately the camera without going into diagnosis or pathology. Because diagnosis and pathology are no doubt present concept, but even there pathology means what is your condition? Is there any dysentery? Is there colic pain? Is there any problem in digestion? Etc. Pathology. Ringworms mostly under the hair. Paralysis of the tongue cold, he termed it what's cold weather. What's cold? Alright, sir. Can these symptoms suit even the present days in the Middle East or in the European region? See the climatic change. Climatic change. Here, just because Hahnemann said umbilical region of the midget, silence of the tongue, we can simply prescribe self-care. So now we have got more deep study of the conditions of the patient and the pathological state. It's called a differential diagnosis. We have got readiness. We have got readiness. Unlike Hahnemann time, we feed everything into the computer by the patient. So, results mostly come. What I am trying to say is that symptomatology is acceptable to the different climatic conditions or change in climatic conditions in the years to come. In the years to come. This is a very thought-provoking concept. I tell you, in physics, they used to have many theories: heat, velocity, etc. With that, they invented machines, mechanisms, even guns, arrows. Now, the deadly weapons. Yes, all these things have been modified according to the change in nature. Similarly, the adoption of homeopathic medicines, choosing of homeopathic medicine based on the changes in climatic conditions, the changes through years have developed. A prudent homeopath can visualize, can understand all these things. So this is interpreted truth. The real concept that we learn, the theory that we learn, Newton's law of motion we have learned, Archimedes' theory we have learned, that the same thing is being applied in all aspects now? No. They only understand the concept, but they modify according to the condition. Similarly, the homeopath also should use his wisdom, use his conditions according to the present scenario. If I am practicing in Bombay, it's a different. If I am practicing in Calcutta, it's a different. If I am practicing in Chennai or Kerala, it's a different. According to the conditions. Supposing a patient from Calcutta has come to Chennai and he searched the homeopathic physician and they located you. You also know the concept of the climatic condition, their habits. Then we say, that's what I mean. The homeopath should be more visualistic, more understanding. so that he can tackle any conditions of any tropical region or any new conditions. For example, we have been circulating about the monkeypox. We need to flavor. We should not get panic. Things will come. Things will come. Our trust, armory of medicine will answer. Okay. The oft-repeated question by the physician, the patient, whenever he comes to the physician, after telling all his symptoms, he will only ask, will you give me assurance? Doctor, will you give me assurance? Doctor, how many days it will take to cure? He knows his condition better than us. But he is questioning us. So for us, we must tell him what are all the difficulties in choosing the medicine and the reaction of the medicine in the body and prognosis has to be evaluated by us, and then so we cannot give assurance. But we must put him in check, saying that unless you cooperate, unless you follow the instructions, medical, I can assure you speedy recovery. Speedy. See, chronic cases, it will take some time. Acute cases, no doubt, you cannot say it is sorry to take time. No, not like that. Yeah. The acute velocity must be put down. Supposing today I got a headache, unbearable headache, for half an hour, when a homeopathic medicine is taken, when he had another attack, supposing that lasts for 10 minutes or 15 minutes, that is a very good prognosis. Very good prognosis. It is not only a confidence to the physician who has chosen the medicine, but physician can make the patient more comfortable and confident that it can be cured very, very short, very, very short. When definitely, most of the homeopathic theories are, when you choose a medicine in the first sitting, because we are oft-repeatingly stating, we say time and again, when the patient comes to the first time to the homeopathic pill, from all abuses of medicines, and we treat, there may not be a very remarkable. Physician need not be flabbergasted or disappointed, because the medicine that has been chosen by the first prescription has been resisting the body from the disease force. So these are all theories. Why you are repeating again? Yes, theories alone will play. Theories alone will play. We should never forget our theories and also see reaction and whereas the theory proves there. Theory comes into the effect there. This is an indication to us. The patient doesn't know about it. A physician can grasp it. Sometimes patient says, "Sir, I don't feel much comfortable." But the way in which he talks, when the dog sitting and the person sitting, and his facial expressions as observed by the physician indicate that definitely there is some reaction and some help by the administrator. Another theory is that suppressed diseases have reappeared. No indications have come. No indications that do not fit with the current treatment. Apparent versus improvement. Lack of apparent improvement may not mean the remedy is ineffective. That's what I'm telling you. Apparently, you don't feel any improvement. That doesn't mean there is no effective action of the drug. Holistic observation. A physician alone can make this holistic observation. He can see changes, subtle changes, changes in sleep habits, dreams, etc. Sir, I get good sleep. I find good improvement in the digestion. The patient may feel there is no change, but subtle signs like the attitude towards the symptom, that is, a spot on the face can indicate the progress. Continuously observe the patient carefully and assess the problems. Assess the problem. This will indicate us that when we give a medicine, we know how many days it will act, what is its power. If it is 200 is given, or if it is 30 is given, action of the drug, you have learned it. That period is chosen for repetition. Supposing 30% is given, you also feel that the medicine will act for 8 hours or 12 hours application. You have repeated the drug next day, you can safely monitor. If the 200% is given, the actual drug will be there for some for 15 days, 1 week. So do you need to say no other medicines will be given? Yes, you can give palliative medicine, biosalts, or the remedy that follow well. The physician must know. By this, he can continue the treatment, make the chain perfect. See, when you go to leading homeopaths, most of them they choose one name. But they give only one dose. Ask them to take it by putting some dates. In between, they give some other medicine that palliates without disturbing the action of the higher potency. Supposing another medicine of the same London potency, what happens? This is 15 days, that is 15 days. So, 1 month is over. In between 14 days, we give multiple biosalts or placebos. What they say? The expert is an expert, sir. Leading doctor is a leading doctor. Yes, no doubt. No doubt. They have license to kill. Whereas we can't use that LM potencies, 1000 potency, because reaction will be there. Supposing there is, I have been always telling you, supposing there is a reaction, the physician himself may feel that the patient will have some reaction. In between he will say, if you get reaction any of these days, because reaction may take after 5 days or after 10 days after 3, he will give you additional dose saying that emergent medicine. You take this in the case of any problem. It is nothing but the very same medicine, putting it under the lower potency. That means the action of the drug is lower. Sir, how is it that when I give 1 potency, 1000 potency, and you are given 200 potency after 10 days, how is it that manages? That is humid. That is humid. The action of the drug, power of the drug is lying on the body. When you give low potency, the low potency drug goes and dilutes the higher value potency. This is a safe way of preventing reaction. This you get by experience, more experience. That is why I am telling you. Repeat the drugs with yourself. Arnica, you take 200. One day you take Pulsatlar 200. One day you take Lycopodium 200. Observe yourself. Observe yourself. If you take 200, it will be there for more than 24 hours or 40 hours. We can understand yourself. We can, whenever a patient expresses, you can very easily understand his situation because your experience reversal. All the medicines being the proven medicine, we express them in terms of symptomatology and the action on the body. But by taking it yourself, you also experience, and your experience in prescribing makes you more perfect, more. That's why I tell you, time and again, prescribe, give, listen to family. See what happens recently in all the languages in the India, Telugu, Kannada, Malayalam, just like information in the apps, you get all other information. Homeopathic is also being given in such apps. They give about the medicines itself. efficacy of the medicines itself. So it is being taught to the public. It is reaching the public. When previously used to say homeopathy means homeopathy, they used to question. Nowadays, when we say homeopathy, yes, it is effective drug. It acts well. I have also experienced. It's the situation. Unless you equip yourself, you cannot come to the rescue of the patients. Thank you, thank you. I hand it over to the Anup.
Thank you, sir. Thank you, sir.
Sir, Anup Kumar, sir, you take.
Okay, sir. Good evening, everybody. Today we will be talking about geriatrics. Geriatrics is a topic which I have been planning to discuss for a long time, because all of us, maybe all of our members mostly, are all in the senior citizen group, and we will see how this discussion will be useful for everybody. Because geriatrics is a topic which focuses on healthcare for elderly people. That is a newly developed topic, even though it has been there for a long time. The speciality as geriatrics has come, is very young in the medical history. So geriatrics, by definition, is the branch of medicine that focuses on the health care of elderly people. It aims to promote health by preventing and treating diseases and disabilities of older adults. The field of geriatrics encompasses various aspects of aging, including physiological, physical, psychological, social changes, and that occurs in older adults. So this is it's a total discussion, total treatment plan for elders. You can see, elders are now in a very they're all almost in old age homes and all, and they find their own friends and they are very happy, relaxed there. So they have to make themselves happy like this. So geriatric, as the global population ages, the global population is not like earlier times. Now the ages, keeping people are alive even after a very old age. So global population keeps aging, and the field of geriatrics has become increasingly important. The WHO, the World Health Organization, defines the older adults as those who cross 60 years and above. Though this can vary from country to country and context also, the reference can be changed. But generally 60 years and above. The geriatric population is growing rapidly, leading to greater need of specialized care and intervention to address their unique health challenges. Elderlies are they are being treated with the specialties and also that is there. Now, significance of geriatrics. Demographic shift. The world is experiencing an unprecedented increase in elderly population due to advances in healthcare. The healthcare has advanced, so people are able to live at least life is prolonged. And so that means elderly people requires care to maintain them. Improved living conditions and reduced birth rates. So the birth rate is coming down. Elderly people are continuing to live. So this demographic shift necessitates the specialized healthcare services to address the complex needs of older adults. So when the adults are getting older, their specialized treatment also is required, and that is one of the significance of geriatrics. Next is chronic disease management. Older adults often have multiple chronic conditions, and that requires ongoing management and coordination of care. Geriatrics focus on optimizing the quality of life and functional status of individuals with chronic illness. Next is the quality of life. Geriatric care aims to enhance the quality of life of older adults by addressing physical, emotional, social aspects of aging. This holistic approach helps to improve overall well-being and functionalities. So quality of life is also focused by geriatrics. And there's chronic diseases. Older adults are frequently affected by chronic conditions such as hypertension, diabetes, heart diseases, arthritis, or osteoporosis. Managing these conditions often involve multidisciplinary approach and including medication management, lifestyle modifications, and regular monitoring. So chronic diseases require multidisciplinary approach, which include medication, lifestyle modification, and regular monitoring. Next is the common issues on geriatrics. That is cognitive decline. Cognitive decline means they are not able to recognize or remember things. That is a condition like dementia. Conditions like dementia and Alzheimer's increasing. Alzheimer's disease are prevalent among the elderly people. So when they grow older, dementia crops in for most of the people. Memory loss, they will not be able to understand, recognize people, and Alzheimer's disease also is common. Cognitive decline can affect memory, reasoning, and daily functioning, requiring specialized care and support for both patients and the caregivers. So caregivers also will have to be trained because it will be new to them. Suddenly, the spouse may ask, "Who are you?" They will not even remember who the husband is, or who the wife is, or who the daughter or child is. So like that, they will totally forget everything by dementia. So the caregivers also have to be trained. In fall and mobility issues. So falls is another major thing. Fall are the major concern for the older adults, are often leading to injuries and reduced mobility. When they fall, they will be bedridden and their mobility will be reduced. Addressing fall risk involves assessing environmental hazards. We have to see what are the environmental hazards and train them and caution them about it. Addressing environmental hazards, improving physical strength. If your leg muscles are strong, you normally won't fall. So all elders will be trained to improve their leg muscle strength, thigh muscle especially, and calf muscle, thigh muscle has to be trained to be stronger, and then you may not fall because your legs are strong. Then increasing the general strength and balance, and modifying medications that may contribute to fall. So certain medications make you feel drowsy, and if that is not okay for that older elderly person, then you have to modify that and give them something better so that they will not fall because of drowsiness. Polypharmacy, that is, it's the use of multiple medication is common among older people. Of many disorders, they will be taking a lot of medicines. Polypharmacy can lead to drug interactions, side effects, and adherence issues. So when they take many medicines for different diseases, it's practiced in allopathic methods, patients will have interactions of the drugs and they will have side effects. Geriatrics care focus on optimizing the medication management to minimize the risks of polypharmacy. Now, another thing is common issues with geriatrics is incontinence, that is urinary and fecal incontinence. They will not be able to hold their urine until they go to the bathroom, or maybe the stools also can escape. So this is because of muscular weakness and all, and that can also be embarrassment for them also. So urinary and fecal incontinence can significantly impact the quality of life and often require specialized treatment and management strategies. So this is another very common issue of geriatrics. Next is nutritional needs. Older adults may face challenges related to nutrition, including reduced appetite because their general function and activities will be low. They will have reduced appetite, so they will not eat things properly. So there will be malnutrition will be there, and they will be having difficulty in swallowing. Then they will have specific dietary requirements. Proper nutritional care for maintaining health and preventing malnutrition is needed. The other thing is mental health. Depression and anxiety are common among elderly people, often exacerbated by factors such as social isolation. they cannot move around freely, they used to be earlier very active person in the society, suddenly they have to withdraw themselves within
இல்ல அங்கேயும் சாப்பிடலாம் ரெண்டு ஒன்று தான்
depression and
ரெண்டு ஒரே காலேஜ்
anxiety.
எடுத்து வச்சுக்கோங்க அது எப்பயும் சைட் பை நம்ம ட்ராப்ஸ் யூஸ் பண்ணி தான்
loss of independence.
ஆமா நான் உங்களுக்கு தனியா பண்ணேன் ட்ராப்ஸ் அது கொடுத்தாலே கொடுத்தேன் நான் போய் டூல்ஸ் தயார் பண்ணி கொடுத்தேன்
mental health is a different part of comprehensive geriatric care. So this many areas still this is more also, but this at least has to be
15.
Now approaches to geriatric care.
அப்புறமா டூ டைம்ஸ் ஒரு மூணு நாளைக்கு 3 டைம்ஸ்
adults physical, mental and social health is essential for developing and so we have to study the patient so we have to study the patient fully and understand what exactly is that specific patient's need and do a comprehensive assessment. This includes evaluating the medical history, current health conditions, cognitive functions and social support. All those things has to be assessed first. Next is multidisciplinary team. The geriatric care often involves a team of healthcare professionals including geriatricians, nurses, pharmacists, social workers and therapists. So this requires a multidisciplinary addressing for geriatrics, where we have all the type of medical professionals also. This collaborative approach ensures that all aspects of older adults' health is addressed. Person-centered care, emphasizing preferences and needs of the individual is crucial because the individual is the geriatric patient and we have to take care of that individual requirements specifically. Person-centered. It's not a general treatment, it's a person-centered treatment. A person-centered care involves respecting the values, preferences and goals of the older adults and involving them in decision making about their care. So we have to explain to them and tell them what we are doing and why we are doing and how we help them so that they will understand why the treatment is being given to them specifically. So person-centered care is required. Next is preventive care. Preventive measures such as vaccinations, screening, lifestyle modifications are important for maintaining health and preventing illness. Geriatric care includes proactive strategies to address potential health risks before they become significant problems. Like we can explain to them the fall causes and the hazardous areas, and then whenever they are to climb some ladders and all, they should not do without any need, and somebody has to be called for that. All those preventive care can be explained to them. Next is functional assessment and rehabilitation. Assessing and improving functional abilities such as mobility, self-care, daily activities is a key component of geriatric care. So geriatric care as a functional assessment and rehabilitation as a main component. Rehabilitation services include physical and occupational therapy. That is, physiotherapy and occupational therapy play a crucial role in enhancing the independence of and the quality of life. So when they are able to move by themselves and they definitely the quality of life is increased. Next is palliative and end-of-life care. Many adults, the senior citizens may be in a very crucial condition where ideally their life is almost over. So they may require only palliative care. Old adults with advanced terminal conditions. Palliative care focuses on relieving symptoms, improving comfort and to providing support from patients and their families. We have to ensure that they are actually do in a very calm and respectful manner. End-of-life care involves addressing their physical, emotional and spiritual needs of individuals approaching to the end of their life. So when you are at the end of the life, we won't be talking about long-term programs of getting them better, but help them to pass out in a very natural manner by giving them emotional, spiritual and physical support wherever needed. Next is family and caregiver support will be required. Supporting family members and caregivers is essential. Supporting family members and caregivers is essential, and they play a critical role in the care of older adults, providing education, resources and help caregivers manage their responsibilities and maintain their own well-being. So caregivers also has to be educated and told that told how they should manage and how to handle the elderly people and who requires their help, so that their life also will not be in distress. So now, having discussed about general parts of geriatrics, now we will see how homeopathy will help in geriatrics. So, we can discuss some medicines and the disease and then medicines. Everybody knows by age, arthritis is a common condition in elderly people and characterized by joint pains, stiffness and inflammation. So, when arthritis comes in, we can talk about Rustox. Rustox is useful for joint pain, stiffness that improves with the movement. So, movement is improving. By movement, the problem is better. That means Rustox, often indicated for pain and Rustox are often indicate for pain that worsens with rest. So when you are taking rest, Rustox patients will have more problems. So, arthritis pains, like elderly people will be sitting, holding their knees, sitting or holding their back. So arthritic patients are suffering with pain, elderly people. So now arthritis again, bryonia helps. Bryonia effective for joint pains that worsens with movement. When you move, the pain is increased means bryonia and improves with rest. Pain is typically sharp and stitching. It's opposite of Rustox. Like it is movement is making it worse. Calcareous carb helps in for arthritis with joint deformities and condition and the tendency to develop cold and damp symptoms. So the calcareous carb is another arthritic medicine. Ledonpalm, we all know, beneficial for joint pains that starts from the feet and move upwards, particularly when the joints are better from cold applications. Next is cognitive decline or dementia. So that's another disease which is going to be addressed now. Cognitive decline includes a form of dementia, involves memory loss, confusion and impaired mental function. Hereditary, often used for old age, related cognitive decline, particularly when there is a tendency to forget names and faces. So when people tend to forget their other names or faces, then hereditary helps to build up the brain. Anacardium orientate used for memory problems and cognitive deficits, especially when accompanied by feeling of inadequacy. So anacardium orientate is to be remembered for this sort of conditions where they will have memory problems and they will feel inadequate. They feel some sort of something missing. You can see the look of innocence and they will not know who is actually holding their hands. They will be searching, but they will not be able to recognize who the nurse or which is the doctor or the child or somebody else, their husband or wife. They will be so innocent when they look at us because their memory is totally gone. Then Lycopodium clavatum helps for cognitive issues with poor concentration and self-confidence. People with such a requirement will have no confidence at all, and they will not be able to concentrate on anything. So Lycopodium can be remembered. Natural salt is indicated for memory problems and mental fatigue, especially when linked with past trauma or grief. So when they have old memories of their sufferings and past trauma, and they have memory issues, natural salt. Next is common thing is digestive issues. Digestive issues such as constipation, indigestion, and irritable bowel syndrome are common for elderly people. So one medicine which we can think about is Naxomica, effective for constipation with sensation of incomplete evacuation and tendency to overeat. They have a tendency to overeat or consume stimulants. So Naxomica has to be remembered, constipation and incomplete evacuation. Lycopodium clavatum again, useful for bloating feeling, gas build in the stomach, then digestive discomfort, particularly when symptoms worsen in the evening. So Lycopodium is good for overall gas, feeling in the stomach and feeling bloated. elderly people will be like you can see like this holding their bellies and suffering. So this will be the digestive issues. So now sulfur, helpful for chronic constipation. It's a strong urge to pass stools and a tendency to have hot, itchy, irritating skin. So sulfur with irritating skin, itchy skin, and urge to pass stools, tendency to have hot, itchy feeling and constipation. Sulfur. Arsenic album, beneficial for digestive disturbances with anxiety, restlessness, and sensitive bone. Sleep disturbances is another issue. Sleep disturbances in elderly include insomnia, restless legs, frequent walking, waking up. So like they'll be keeping on, like they keep waking in a small naps they take and they wake up again. They won't have continuous sleep. So sleep disturbances will be there. For which coffee or cruda is useful for insomnia due to racing mind or excessive mental activity. Brain activity will be too much. They will be thinking many things when they are in the bed, and before morning they have to do certain things. Morning they have to do certain things, but they will be planning for that. Mind will be very active and they will not be able to sleep. So coffee or cruda will help in such a condition. Next is ignitia amara, effective for sleeping disturbance caused by grief, emotional stress or disappointment. When they are thinking about their some past trauma, grief and disappointment, emotional stress, ignitia works very well. Naxomica helps for insomnia with restless, irritable disposition. They will be irritated and restless, and the tendency to overindulge in food and stimulants, food or stimulants like pickles and all. They will like to have vinegar based things and some sort of stimulants so that they will have more they can eat more. So and they have insomnia and restlessness also. So Naxomica. Pulsatilla nigrans, beneficial for sleep issues with changeable moods and need of fresh air. So they won't like to close the windows and all. They will, doors and windows should be kept open, and they will be having changeable moods and sad and sulky feeling, and also pulsatilla works. And in the midnight they will sit up and wait and watch to see like what happens. They will be thinking and sleeping. So sleep disturbances in elderly people is common. Anxiety and depression. Anxiety and depression are prevalent in elderly and can significantly impact their quality of life. Ignitia is used for anxiety and depression related to emotional aspects, grief or suppressed emotion. So ignitia works well. Natural medicator, Nodiaticum is helpful for depression. With a tendency to isolate oneself and deep-seated sense of loss of sadness. So helpful for depression with a tendency to isolate. They will sit alone, and they will be thinking about deep-seated sense of loss and or sadness. That works well. Anxiety, anxiety, restlessness, fear of illness, and excessive need for reassurance. Excessivia, beneficial for depression with the sense of apathy and irritability and feeling of being overwhelmed, especially in women. Severe also and then women. In anxiety and depression, somebody has to they're trying to console each other, and it may not really need medication is given, so they need support from the spouse. Hypertension is high blood pressure is a common issue among elderly people and can lead to other health complications. Naxomica is used for hypertension with irritability, stress and tendency to overindulge in food and stimulants. Aurum metallicum helpful for hypertension with a sense of deep sadness or self-reproach, particularly for if accompanied by cardiac symptoms. So aurum metallicum with cardiac symptoms and hypertension. Then Crataegus is a very good medicine, often used for heart conditions with hypertension, associated symptoms like palpitation or breathlessness. Crataegus. The pressure being checked, monitored by the doctor. Next is osteoporosis. We all know when elderly people fall, they may break their bones because their bones are spongy bones. Their calcium is removed out of the bone. So osteoporosis is a condition characterized by weak bones and increased risk of fracture. Calcarea phosphorica useful for bone pain and weakness, especially in case of osteoporosis. Silesia beneficial for bones health, particularly when there is a tendency of poor absorption of calcium and brittle bones. So silesia Calcarea phosphorica. Now Symphytum officinae, we use it for joining the broken bones. Now it will help for promoting the bone healing also, like inside. Often for promoting bone healing and managing the pain related to bone pains, we have to remember Symphytum. You can see good bones and their texture, normal bones and their texture, and their matrix and all, it can be in uniform manner. Whereas osteoporosis, you can see everything is degenerated and the empty areas are more, and it looks like a sponge. It can break very fast. Incontinence. We have come to the end of our discussion. Incontinence is like a loss of the power to hold their bladder or urine in their bladder. Involves involuntary loss of bladder control, and commonly in elderly people. It's found in elderly people. Causticum, helpful for urinary incontinence with the feeling of weakness and tendency to have difficulty in controlling urine flow. So when they want to control also, urine escapes and it will wet their pants, so that is an embarrassment for them. And same thing will be the fecal incontinence also. Berberis vulgaris will be used for urinary issues and discomfort and pain, especially if associated with the sensation of fullness and in the bladder. Alsatia is effective for urinary incontinence. It's changeable nature and tendency to seek comfort.
బయలుదేరండి ఇక్కడ బాగుంటే అయిపోతుంది క్లాస్ ఉంది 5:30 రెడీ ఏది ఎక్కడి నుంచి ఎక్కడి నుంచి
So now this is the discussion plan for today. So I am continuing now. So thank you.
రాలేదు ఓన్లీ రెండు ఇవి వచ్చాయి, పైన కింద అట్టలు వచ్చాయి, అవి వచ్చాయి రాలేదు. ఓకే
Maybe sir.
Sir.
I have finished. Sir.
Okay. Is my voice audible?
Yes sir. Yes.
Namaste my dear homeopaths. Thank you very much Surendra sir and Anup sir. Both have taken excellently. Surendra sir has taken about the potency variations. What type of potencies we have to give, what type of this one. And Anup Kumar has taken the geriatrics preferably in this class. Next week I think we are having guest lecture. Our senior member Mr. Suresh Rao will take about urinary problems, and next week if time permits I will ask these two classes what Surendra sir today told about potency and Anup Kumar sir has told about geriatrics. On these two I will ask certain questions next week. Be prepared. Suresh Kumar sir, you can take.
Yes, sir.
You can take, sir.
Can I come?
Yes, you can come.
Okay. Anup, is audible to everyone?
Yes, it's audible. Go ahead.
Good afternoon and good evening to everyone. Today I thought I will be a little away from our organ text. I thought some useful text should be given from therapeutic point of view, and that I thought a small session on this subject will be taken by me now. So some brief therapeutic indications I will try to summarize. Whenever we talk about the remedies, there is a huge number of remedies are there with a particular condition or particular disease. But as a physician, as a quick recollector of the remedies for a particular situation or particular disease condition, that is very essential. And that too, the primary remedies. The primary remedies or the first grade remedies has to be kept in my mind always. In a minutes or a flash of seconds, when the disease condition is perceived, immediately we have to recollect these 4 or 5 or 6 medicines from our kits or armory, so that we can prescribe immediately. So from that point of view, for the quick recollection and quick prescription, some of the prime remedies for a grievance situation or given condition, we have to keep a remembrance of it. That's why I thought we'll take some small notes on this. So we'll get into prime remedies with reference to particular condition. Let's start with abortion, a female condition, abortion. As soon as the abortion condition is present in mind, what are the remedies, prime remedies comes in mind. The first, immediately we can think of Sabina, we can think of Sepia, we can think of Simicifica, we can think of Cornophyllum, we can think of Sicyl cornatum, and these are the primary, 5 or 6 remedies immediately it should come to our mind. So whenever we say the situation abortion is perceived, then immediately the Sepia, the Sabina, Simicifica, Cornophyllum, and Sicyl cornatum. These are the 5 friends. I can say just like a trios. In few days back I have taken classes about the trios, but here I am extending a little bit to 4 or 6 remedies, 5 or 6 remedies, which are prime remedies to a particular condition. So whenever we say abortion condition is perceived, then in that case these remedies, Sabina, Sepia, Simicifica, Cornophyllum, and Sicyl cornatum, and one more remedy, Viburnum, also comes in our mind. So these are the very prime remedies with a given condition. Then comes abscess. For abscess, ulceration, ulcerative conditions, what are the prime remedies? Immediately should come to mind. Then that situation, obviously, the first remedy comes in our mind is Hepar. Then the next remedy in order of preference comes Silesia. Then comes our Maxor, then sulfur, and then obviously our best friend Belladonna and Lachesis. So immediately these are the 6 prime remedies with reference to abscess. So I repeat: Hepar sulf, Silesia, Maxor, sulfur, Belladonna, and Lachesis. These are some of the prime remedies or first grade remedies. I will, as per our veterinary or recognition process, these are known as first grade remedies or the prime remedies for a given disease condition. Now next we come to another situation or condition called acne. What are the prime remedies with reference to acne? So with reference to prime remedies, all of us we know the important remedy. One is Berberis aquifolium. We can never forget this remedy. But the next prime remedy, obviously our choice extended to Thuja. That next our prime remedy, Antimonium cruda. Next prime remedy, Calibromatum, and then obviously sulfur. So these are some of the prime remedies or first grade remedies with reference to acne. So I repeat: the Berberis aquifolium, Thuja, Antimonium, Calibrom, and sulfur. These are some of the prime remedies. 5 or 6 remedies immediately flashes our mind. Then come to the very common clinical conditions, dyspepsia or called acidity. When the acidity is reported to us by patient, what are the prime remedies immediately flashes in our mind? So obviously the prime remedies, one can think the trials like Lycopodium, Carbohydrate, and Pulsatilla. Definitely these are the prime remedies: Lycopodium, Pulsatilla, and Carbohydrate for acidity. But one should not forget the foremost prime remedy, Nux vomica. The Nux vomica, and then coming to Calcarea carb also. So whenever the acidity is being perceived in a particular condition, then obviously carbohydrates, Lyco, pulsatilla, calcareous carb, and next vomica. Also we can think of acidic and sulfur also. Sulfur is also great friend, but very rarely we choose and go for it. But these are the prime remedies for acidic conditions. The next, another condition I will go for Addison's disease. This Addison disease is you may ask what is this Addison disease? Addison disease is a disorder of the adrenal gland. It is a disorder of the adrenal gland, and the adrenal gland don't produce the enough hormones, particularly cortisol. The cortisol is too little production happens in case of Addison disease. So Addison's disease is a concern with the adrenal glands and low production of the hormones. So whenever the Addison disease is there, what are the prime remedies comes in our mind? Obviously, the prime remedies are arsenic alum, then natramine, then belladonna, phosphorus, then calcareous ars. These are the prime remedies with reference to adrenal glands. I repeat: arsenic alum, phosphorus, calcareous arsenicum, natramine, and belladonna. These are the first grade remedies or the prime remedies indicated towards Addison's disease. Then the next condition I am going to talk about is agalexia. Agalexia is already been talked about in many classes or previous classes. Agalexia is a situation of failure to produce or secrete milk. It's a failure to produce or secrete milk. This situation is known as agalexia. And what are the prime remedies with reference to this situation? Obviously, when we talk about this agalexia situation, the first prime remedy comes in mind is your pulsatilla. And next in order, when we go lactaninum, with that mind stops. But for the given situation, we have got other remedies like argentum nitricum, chamomilla, and also Urtica urens. Urtica urens also a very good remedy for agalexia. So I repeat, there's 5 remedies in the group, that is pulsatilla, lactaninum, and argentum nitricum, then chamomilla, as well as Urtica urens. So these are the prime remedies with reference to agalexia. Then coming to alphabetically another situation, alcoholism. So what are the important remedies can be prescribed for the situation like alcoholism? Then the first medicine which can we think of is the next vomica, very powerful potent remedy for this next vomica, and then cannabis indica, capsicum, opium, hyoscyamus, and curcus. Okay, these are the prime remedies for the situation alcoholism. I repeat: next vomica, cannabis indica, capsicum, opium, hyoscyamus, and curcus. So these are the prime remedies with reference to alcoholism. Coming to next in alphabetical situation, we can talk about alopecia. Alopecia, all of us know, is hair loss, that particularly patchy hair loss. Patchy hair loss is known as alopecia. So what are the very important remedies or the prime remedies with reference to alopecia? The moment the mind goes, immediately acid falls. When we talk about situation, acid falls is the prime remedy. But with that, we can go for natramine, we can think for acid flow, we can think of phosphorus, we can think of arsenic album, we can think of vinca minor. So these are some of the 5 or 6 remedies, prime remedies, I can talk about for the given situation alopecia. I repeat, natramine, fluoric acid, phosphorus, vincamina, arsenicum, and what's called phosphoric acid or acid phos. So these are the primaries. Coming to the next situation or the disease condition, amenorrhea. When we talk about the amenorrhea, what are the prime remedies? Obviously, the first choice will be your pulsatilla or your sepia, or we can think of calcarea calm. But the list doesn't stop here. The primary remedies include not only these three, pulsatilla, sepia, and calcarea calm, but ferrum metallicum, then graphitis, and bryonia. These three can be added to this prime remedies. So for amenorrhea, we can equally think of pulsatilla, ferrum metallicum, sepia, graphitis, calcarea calm, and bryonia also. Then coming to next disease condition, anemia. Anemic situation, what are the indicated drugs? So when we talk about anemia, the mind goes the first into ferrum group, the ferrum phos. Okay, so ferrum group remedies are that of course we no doubt about it, but equally we can talk about China also. So in anemic situation, these are two prime remedies flashes in our mind, but the list doesn't stop here. The other prime remedies are natramine metallicum, arsenicum album, calcarea calm, and pulsatilla. These are other prime remedies for this anemic situation. So a list includes ferrum metallicum, ferrum phos, and calcarea calm, arsenic album, natramine, China, and pulsatilla also. Then the next situation or disease situation I would like to add is anasarca. Anasarca is another situation, is a massive disorder of fluid retention, or it is called as a massive edema in multiple parts of the body. When there is a massive generalized edema is present in multiple parts of the body, then anasarca is the name or disease situation called it. So in that situation, what are the important remedies? Immediately when we talk about edema, it comes in mind. The next is your apocynum comes in mind, and with that the full stop comes. But the other remedies are equally important. Remedies in this group is digitalis and elytra. So these are the other two important remedies for anasarca prescribed by our masters. So for anasarca, apis, apocynum, elytrium, and digitalis can be thought of in our clinical situation. Then coming to next situation, angina pectoris. When angina pectoris, all of us know, is a pain in the chest, and due to interference of the interference in the supply of the O2 to the heart muscles. Whenever there is a interference or the less oxygen supply to the cardiac muscles, then it leads to chest pain, and that is known as, and situation is known as angina pectoris. And for the angina pectoris, we have got immediately mind goes in the important catechus, no doubt about this. Then cactus and catechus we think of always, but equally other primary remedies are spigelia, quinoline, then amyl nitrosome also. So along with our catechus, good friend catechus and cactus, we can add to this list spigelia, quinoline, and amyl nitrosome. So these are other remedies, group of remedies we can think of in an angina pectoris also. Then coming to next disease condition, anorexia. anorexia is known as loss of appetite. For loss of appetite, what are the important memories? The first in mind goes lycopodium. No doubt about this. The mind of the lycopodium and pulsatilla flashes immediately. But next to it, the anorexia comes for China also. China is also important. But in this list, apart from lycopodium, pulsatilla and China, we can add hydrocetus, arsenicum album and nexmomica 2 here. So a group of 6 can be formed for anorexia. I repeat, lycopodium, pulsatilla and arsenicum album, China, nexmomica and ars album. These are the 6 prime remedies with reference to anorexia. And then coming to the aphonia, another situation is called aphonia. Aphonia is known as loss of voice. Loss of voice, what are the remedies, prime remedies for loss of voice? The mind comes first is hospital. Whenever there is a loss of voice, we can think of always 2 remedies. One is causticum, then aluminum, and sometimes we can think of cannabine also. And but with this, doesn't stop. The prime remedies conclude your spongia, nitric acid, and oxalic acid too. So a group of 6 forms a first prime remedy for aphonia: causticum, cannabine, aluminum, nitric acid, spongia and oxalic acid. These are the prime remedies for the situation aphonia, loss of voice. Then the last situation I will stop with this, apthe. Apthe is a situation, ulcerations in the mouth. And whenever there is ulcerations in gums and mouth, then the primary remedy, obviously we think of borax. Always the borax flashes in the mind, and with that next remedy comes in mind is your moxalox. But along with this, the other remedies are prime remedies for apthe is your thuja, calimuriaticum, calimur, elusa and nitric acid. So group of the 6 forms of prime remedies for the apthe, that is borax, thuja, calimur and elusa and moxal and acid nitricum. These are the top 6 prime remedies for the situation, apthe or the ulcerations in the mouth. So with this and deep thoughts to it, I thought that this short briefing of the remedies can be done for quick recollection in the clinical conditions. That's why I thought this tips can be given always so that it will be handy in our clinical cases. So with this, I give a pause or stop to the situation and hand over to Dr. Bhurji.
Sir, thank you very much for Surya Kumar sir. But I think you have put more load on the elite group. Today you have given an excellent so many drugs, very important drugs. I think our members, please, today I am sending the recorded audio. Please once, twice or thrice you listen all those things. Next class, I will ask certain questions. Please answer that one. Preferably, as mentioned, angina, urticarians, some drugs, very important. Those are most important for allied group. So if there is no questions, then we will stop this lecture today, sir.
Okay.
Because our in my house current has gone, so recording will be stopped. Okay, thank you very much.
Thank you very much.
Thank you very much. Next week we will meet. Thank you.
Okay.
Sir, I have a question, Dr. Murthy.
Yes, sir.
I told the patient there is a problem of arthritis and there is a pain in the legs, and X-ray was showing knee joints, bilateral osteoarthritis. Because of that, so I was trying Rextox 30 and then hypericum 200.
Ah.
I want to add
Ah.
either bryonia or causticum.
Ah.
So I wonder what could be the right combination. Actually the person while resting no pain, but while walking or climbing stairs and he gets pain. So slight improvement is there. So whether I can go for I was wondering for the right combination.
As far as Lustrax is concerned, you have taken a good drug, it will reduce the pain. But for this you have to give Symphytum and Calcareous combined. Symphytum and Calcareous combined in 30 potency along with any other Calcareous CP.
Okay.
Not 6x, it is 30. Calcareous 30 and Symphytum 30 put together one dose. Like that, daily 2 doses, minimum 1 week to 10 days. Along with that, any other remedy you can take it, either Ledampol or Arnica, whatever it may be. But don't mingle 30 and 200.
One more point, sir.
Sure, tell me, sir.
Yeah, what he said is the pain is increasing when movement, so Lustrax won't work.
Lustrax is not proper remedy. It is a palliative remedy.
I discussed bryonia today. I discussed bryonia today, so bryonia you try.
Yes, bryonia I was thinking, I am having bryonia.
You give that and see, it will be better because today's session I have discussed.
You discussed in the discussion. Lustrax, bryonia also. Bryonia is a very good medicine.
No, I told that bryonia will be for the problems which is worse by movement.
Because you have mentioned walking, movement and everything aggravating. So bryonia is a proper medicine, Lustrax a palliative.
Okay, thank you, sir.
Thank you, sir. Thank you. Next week we will meet.